Before you view our video, please take a moment to subscribe our channel by clicking the subscribe button, then tapping the bell icon to never miss any update. What are signs of labor starting? The experience of giving birth can differ from one woman to another, and even for the same woman from one pregnancy to the next. Although there's no way to know how a woman's labor will progress or how long it will last, it's not unusual to be fearful of the process and worried about the pain associated with it. How will I know it's time? Every birth is different, but we can help. There are some clear labor signs to watch for. Pay attention and they'll tell you that baby's on the way. Contractions. You'll feel like your stomach is making a firm fist. Call your doctor if your contractions strike every 10 minutes or more frequently. Braxton Hicks contractions are common now, but they come and go more randomly. You start having contractions before 37 weeks or have any other signs of preterm labor. Last symptom is bit interesting. Sudden burst of energy. If getting up off the sofa is about as much activity as you can manage for most of your last trimester, the sudden spurt of energy you get in the days before labor starts, and the urge to clean out your kitchen cupboards, is often a not unpleasant surprise. Make the most of it. Sort out the house, organize your baby's clothes and set up a few change stations ready for her arrival home. Water breaking. Only 1 in 10 women experience a dramatic gush of amniotic fluid. This event usually happens at home, often when you are in bed. Sometimes the amniotic sac breaks or leaks prior to labor, and because your uterus is resting directly on top of your bladder, it can cause you to leak urine. Sometimes it can be difficult to distinguish the urine from amniotic fluid. If your membranes have ruptured and you are leaking amniotic fluid, it will be an odorless fluid. The discharge can be a sudden gush or a constant trickle. It is a clear sign that your labor is going to start. Involuntary shivering. Even if you are not cold, you might experience shivering or trembling as a sign of early labor. The same thing can happen during or after birth and can be frightening if you aren't sure why it's happening. It's simply your body's way of relieving tension and usually lasts only a few minutes. Your nipples leak. It's not just during breastfeeding that nipples can leak, it's all throughout your final trimester. You'll probably notice it most in the last few weeks before your baby arrives. The milk you're leaking is colostrum, a nutrient-rich liquid that will nourish your baby until your proper milk comes in a couple of days after the birth. Diarrhea. Just as the muscles in your uterus are relaxing in preparation for birth, so are other muscles in your body, including those in the rectum. That can lead to loose bowel movements. Though annoying, this is normal. Stay hydrated and remember it's a good sign. Lightning or baby dropping. Your baby might start moving lower into your pelvis as he gets ready to come out. This can be especially noticeable if your baby has been positioned right under your rib cage for the last few weeks. You will feel lighter as baby move down,